Good morning, Doctor. We are from Group SGD. Now we'll do our presentation about our student project, which entitled Psychopath. And here are our group members.
Meet you, and I want to describe about the background of psychopathy disorder. First thing first, people with psychopathy disorder usually have less on or non feeling for the others and violate social norms with no sense of guilt or regret. Second, psychopaths are believed to be synonymous to sociopathy or antisocial personality disorder. Third, psychopathy itself isn't included in the DSM-5 diagnosis or ICD-10, but the psychiatric diagnoses are focused on antisocial behavior than the underlying causes. As a result, people that are diagnosed as antisocial personality disorder or APSD are more varied in their pathophysiology than people diagnosed as psychopath. Thank you.
Here are the research questions from this paper. The first is, what is the definition of psychopath? How is the history and epidemiology of psychopath? What is the risk factor of psychopath? What is the sign and symptoms of psychopath? How to measure and assess psychopath? What is the differential diagnosis of psychopath? What is the treatment of psychopath? What are the criminal issues of psychopath? The purpose of the research is to answer and to understand the research questions before. There are two benefits of the research. The first is as the basic information about psychopaths for the future research. Second is increased knowledge about psychopaths.
Psychopath definition, according to Cleckley 1941, is individuals who have high intellectual abilities, allowing them to manipulate others. Moreover, their lack of attentiveness to others due to their reduced empathy levels make them less responsive to others' distress. There is two classification of psychopaths according to some studies, which consists of primary and secondary psychopaths. And there are three different perspectives in defining psychopath. With the first one is behavioral profile, where psychopathy characterized with emotional deficiency such as lack in feeling of guilty and sympathy, and also characterized with violent behavior and antisocial behavior, which give them a higher tendency to commit crimes. The second one is cognitive profile. It is regarding psychopathy relation with the theory of mind, or TOM, which similar in concept to cognitive empathy. Because of its similarity, it is possible that the lack of emotional sensitivity in psychopath is bound to the deficiency in TOM. The third one is neural profile. Although it is relatively a little mechanism in neural in the underlying psychopathy, there are some studies that have reported change in amygdala and orbital frontal cortex activity in children with psychopathic traits.
The history of psychopathy saw there are three classes of mental illness in the 18th century, but the psychopath didn't fit in any of these classes. Philip Vanel started to describe the psychopathy as the insanity without delirium, and there was another common term is moral insanity. Psychopathy term comes from the German word that credited to the German psychiatrist coach in 1888. And then psychopathy term was replaced by sociopathy term in the 1930s. German School of Psychopathy broadened diagnosis of psychopathy. And then in 1939 and 1941, Henderson and Cleckley published their book that led to a re-examination of the German school approach.
In the 80s, clinicians described psychopathy through DSM-3 as persistent violation of social norms with antisocial personality disorder, and DSM-4 revised it but still have no guidance to incorporate the two criteria. PCL then revised into PCLR as diagnostic instrument, where 3% people with has psychopathy who came into the forensic psychiatry, but it still has no exact prevalence of psychopathy itself.
Risk factors: prenatal smoking exposure. Nicotine can pass through the placenta, reducing flow of nutrients and oxygen, which hinders cognitive development. Prenatal alcoholic consumption causes deformations in the right caudate, reduced amygdala and striatum volume, as well as impeding maturation of white matter tracts. Heavy metal exposure. Lead is a neurotoxic that is documented to cause an overall 1.2% of loss of gray matter in the brain. Air pollutant. Polybrominated diphenyl ethers are associated with externalizing behavior. Traumatic head injury. Early head trauma contributes to abnormality in the brains of individuals with antisocial personality disorder. Sleep problems. Sleep deprivation causes overvaluation of rewards and undervalue of punishments. Nutrition. Nutritional inadequacy is conjectured to affect brain development and neurodevelopmental functioning negatively.
Now about signs and symptoms of psychopath. The first is overconfident. People believe in confident people easily, and psychopath knows this and make use of it. So, second is self-destruction. Psychopaths is at high risk targeting their aggression toward themselves. Third is having no empathy. They can hurt anyone, including their close people. Fourth is highly impulsive. If psychopaths want to do something, they will do it without considering the consequences. Fifth is deceitful. Psychopaths will make up stories about who they are to hook people. Sixth, they don't apologize. Instead of admitting that they were wrong, they will offer a plenty justification. The last is having no conscience. They can act innocent after they harm to others.
The assessment tool of psychopathy is Psychopathy Checklist Revised, created by Robert Hare. It contains 4 dimensions, and the cutoff score is above or same with 30, indicating psychopathic, except in Europe, above or same with 25, indicating psychopathic. PCL shorter version, it contains 12 items, and the cutoff score is above or same with 18, indicating psychopathic. PCLEV is youth versions. It's for 12 until 18 years old. It contains 20 items, and the total score is 0 until 40, and the cutoff score is above or same with 30, indicating psychopathic, or except in Europe, above or same with 25.
Differential diagnosis of psychopathy. The first is SGD. Someone with SGD is lacking some symptom essential in psychopathy, including lip charm, absence of empathy, social affect, and consent. The second is sociopathy. Sociopathy usually doesn't bond with people outside their group, while psychopathy usually doesn't bond with anyone. Sociopathy develops from normal individual as a result of environmental factors. The psychopath shown to be able to control their emotion better than their sociopath counterpart. The next is narcissistic personality disorder that can be distinguished by the lack of impulsivity, aggression, deceit, and may lack the history of previous criminal behavior. The last is borderline personality disorder that can be distinguished by their tendency of self-harming behavior and greater risk of suicide.
So for the treatment, many people believe that psychopathy is an untreatable condition because psychopath's behavior cannot be improved by either traditional or non-traditional therapy. Psychotherapy for psychopath requires patients to become active participation. Meanwhile, psychopaths have no desire to change their behavior because they don't feel that they have psychological problem. There is evidence that some treatments make things worse. In a study, rate of violent recidivism were higher in treated psychopaths compared with untreated psychopaths. One of the methods that can be effective in reducing antisocial behavior is the decompression model. The decompression model is a cognitive behavior intervention that immediately rewards all positive action and gesture and prevent to reduce recidivism.
Well, until now, there hasn't been any perfect treatment that can cure psychopathy. All that can be done is we find a workable and available approach so we can use it to assess and treat certain domains of psychopathy. For example, the psychopathic individual's pattern of violent behavior. In terms of medicine, clozapine has shown a great result in a study which involved 7 patients with primary ASPD and high psychopathic traits. After given clozapine, 6 out of 7 patients had shown a lowering number of violence committed significantly, and also reduced risk of violence in all the patients. It is shown that clozapine brings improvement on all symptoms domain. Distinctly, impulsive behavioral discontrol and anger, also lowered levels of violence and aggression.
So regarding the criminal issues related to psychopathy, so due to the nature of the condition, psychopathy causes individuals to act based on what benefits themselves in short term the most at the expense of other people. There's a variety of crimes tied to psychopathy, but it is not limited to the more mundane ones like cybercrimes. However, the condition is also tied to more severe ones like aggression, early delinquency, juvenile incarceration, homicides, and intimate violence. Recidivism rates are also much higher in psychopaths, and they also tend to recidivate faster into prisons.
As we come to the conclusion, so the first conclusion is psychopathy is a pathological interpersonal who has high mental capacities permitting them to control others. Second, the term psychopathy comes from the German word psychopathisch. Third, human interaction, negative psychosocial angels, and birth complication has been recognized as a risk factor for psychopath. Fourth, overconfident self-destruction, having no empathy, highly impulsive, deceitful, and having no conscience are known as signs and symptoms of psychopaths. Fifth, PCLR, PCLSV, and PCLEV is used to measure the psychopathic condition. Six, SSPD, sociopathy, narcissism personality disorder, and borderline personality disorder are known as differential degrees of psychopathy. 7. Psychopath has been linked to criminal behavior, and the last one is decompression model and clozapine are recognized as an effective therapy to overcome psychopathy. Thank you.